The gastric band, that's the operation that has become more common in the last few years. It was approved in the U.S. in 2001 for use. It also is done laparoscopically. The small incisions in our program, the band takes about 30 minutes, the bypass takes about 45 minutes. The sleeve is kind of in between the two. So not a lot of difference in time, but inside there's a lot of difference. With the band, remember again with the bypass, we physically cut through the upper part of the stomach to create a small stomach. There's no cutting or rearranging of anything with the band. So there's no cutting of the intestines, there's nothing like that. But what we do instead of cutting through the upper part of the stomach is we wrap this band, which is like a belt, around the upper part of the stomach. What that does is it creates that small stomach above the band, so the same effect occurs. The food comes in, gets caught up in that upper part of the stomach, signal back to the brain that says, I've had enough, I'm satisfied with this normal portion of food, and that's how that functions. And then the food works its way through that restricted area, through the band, into the rest of the stomach, and then through the rest of the anatomy just like it does now. So there's no rearranging of the anatomy with the band. What's very important to understand about the band is a great operation because it can be very effective if used properly, and it can be very safe. It can be performed as an outpatient in many cases since we're not cutting things and moving things around. However, the important thing to understand about the band, the bypass is more involved operation, but after surgery everything's set. The band, less invasive as far as the operation goes, but after surgery it's important to understand the follow-up necessary and the ongoing maintenance of it during the weight loss period. And what I mean by that, it's very easy to understand if I compare it to if you go on a diet now, what happens to your waistline? Your waistline shrinks, right? Because what's happening is that the fat cells under the skin are very plump. As you lose weight, those fat cells shrink. So all those fat cells shrinking around your body under your skin decrease your waist size. So what do you have to do? You have to tighten your belt. Right? You either have to get a new pair of pants or you have to tighten your belt. Same exact thing is happening inside the body with the band. The stomach, and the picture doesn't show it because it just isn't pretty, but there's a lot of fat tissue around the stomach. So when we put the band on, we wrap the band around fat tissue and stomach. So what happens is that as someone loses weight, those fat cells inside the band areas shrink. The band essentially becomes loose as you lose weight because the same thing is with your waist belt. The fat cells have shrunk. In order to keep that tightness the same, we need to be able to adjust the band. And that's what's unique about the band. That band that we wrap around the upper part of the stomach, inside of that band is a balloon. That balloon is connected by a tube to what is called a port or a reservoir, which is located under your skin. You can't see it. It's tied to the muscles below. But what that allows us to do is to inject saline into that port. That saline goes through the tube and blows the balloon up and makes it tighter. So if someone loses weight and the band becomes loose, we add a little bit of fluid in order to keep that tightness the same. Now, this is not an everyday process. It's not even every week process. For most patients, once their band is at the level it needs to be and as they lose weight, an adjustment is usually good for 2 or 3 months. Everybody is different, so some people may go 6 months without an adjustment. Some people may lose weight very quickly and they might need an adjustment after 6 to 8 weeks. So it varies and it can be customized to each individual. That's the good thing about the band, is that it can be adjusted to each person because we all have different amounts of fat and thickness of stomach tissue. So one band size would not work because it wouldn't fit everybody and it would get loose over time. So during the weight loss process, which for a lot of people with the band may be 1 year, 2 years, maybe 3 years, there would be requirements to have that balloon adjusted, okay, as opposed to the bypass or the sleeve operation where there's nothing to adjust, there's nothing, it's already set. But the band is less involved before and during surgery, but then more involved in the sense that you have to have the adjustments. If the band's too loose, it won't be as effective because it won't take away hunger and it won't allow somebody to be full or satisfied with that small amount of food. The top part of the stomach is what's responsible for sending the signal back to the brain that says, I've had enough. That's what satisfies the satiety. No one clearly understands the mechanism. There's all sorts of research going on, but the upper part of the stomach is what is responsible for sending that signal back for satisfaction.